Thanks for your patience, everyone. Just giving it a few minutes as we know we've got a lot of people signed up today. I'm sure we'll have a few more people trickling in, but I'm going to crack on so we can cover everything that we've got in plan. So hello, and thanks so much for joining. For anybody who's not met me, seen me before in a webinar, I'm Sophie. I'm a Principal Communication Strategist at Frameworks UK. And we've been partnering with Joseph Rowntree Foundation and the Nationwide Foundation to identify ways that we can all communicate about housing in the UK to help improve people's understanding, the quality of discussion and debate, and ultimately lead to positive changes in our housing system. You may well have joined one of our previous webinars. We've done a few over the last year or so, and all of these have been looking at how we can tell a new story about homes in the UK. Today, our focus is going to be a little bit more directed on how to communicate in ways to grow support for building social homes. So while our materials and our sessions so far have been taking that wider view of homes in the UK, we're focusing on this key part of the story for today's session and how we can apply what we found to this in particular. A few bits of housekeeping before we get started. We are recording today's session, and we already have recordings of our previous webinars as well, which are available on JRF's YouTube channel. And also then it means if you've got any colleagues who couldn't make it today who you think actually might benefit from having a watch of this, do share the link to the recording, which we'll be sharing after today's session. You'll notice that you're all on mute, you all have your cameras off. It'll be that way for the duration of today because we set it up as a webinar because of the large number, hundreds of you joining. So I'm afraid we can't see all your faces. But just to reassure you, that's totally normal and you can still get involved. We've got the Q&A function today. So if you've got any questions as we go through, please pop them in that Q&A box and we'll be selecting a few of them to answer the Q&A towards the end of today. So I'm going to be speaking for roughly 40 minutes, then we'll move on to that question and answer. At that point, my colleague Kate is going to come on screen, choose a few questions to pose. We've also got Natalie from JRF, who's in the background today, but may pick up some of your questions as we go through it as well. Lastly, please feel free to add your organisation's name to your name on Zoom. It's just great for us to be able to see where people are joining us from when we get to taking your questions later on. Now let's get started. First, a little bit about Frameworks UK for anyone that's not met us before. We are a not-for-profit and we specialise in evidence-based communication strategies to shift hearts and minds. That means we help charities and other mission-driven organisations to communicate about social issues in ways that create progress. And we do that through practical guidance, which is underpinned by our framing research. Now, Frameworks research shows how people understand social issues. It tells us not just what people think, but why they think it. And we use this knowledge to develop and test different communications approaches that will help organisations create the lasting change they want to see. A bit more on that very shortly. Here's just a flavour of some of the organisations we've worked with in the UK recently. So you can probably gather from this selection of logos that we mostly focus on issues around children and families, homes, poverty and health. Now, I don't expect you to read this slide in any detail. It's a bit of a word dump here, but suffice to say that we have a solid research base which we are drawing from for today's session. So this includes our latest research with Joseph Rowntree Foundation and the Nationwide Foundation, which is looking at talking about homes. This also includes some specific research that we did that focused on social homes. And also we're drawing from previous research with JRF, exploring talking about poverty, our work with Crisis, which focuses on homelessness, and also some work we've done with the Health Foundation on explaining the wider determinants of health. So all of this gives us a really rich evidence base to draw from. And all of these resources are available on our website, frameworksuk.org, if you would like to dig into more detail. In each case, our research has included both qualitative and quantitative testing, so a combination of large-scale, nationally representative surveys and interviews and peer discourse sessions, which are a type of focus group where we test the use of new frames in a conversational setting. So All this to say, the principles I'm sharing with you today come from a really robust base. But rather than doing a deep dive into the research itself today, I'd like us to really focus on what we can do with those insights, what they really mean for communicating about social homes. We'll start with a quick recap of what framing is and why it matters, just in case there's anybody who's newer to this work. And then we'll take a look at how people think about social homes, the communications challenges that we face, before heading into the bulk of our session, which is how we can build an effective story that answers those challenges. And so let's get going. What is framing and why does it matter? Now, framing is the choices that we make about what ideas we share and how we share them. This includes what we emphasize, how we choose to explain an issue, and also what we leave unsaid. Now, this matters because these choices can lead to quite radical changes in how people think, feel, and act. All of us are framing all of the time, but when we make these decisions deliberately and backed up by evidence, we can make them with a considerable degree more confidence that our communications are going to be landing as we intend them to. And I'm going to just share a couple of quick examples to illustrate the difference that framing can make. So first of all, in this classic experiment, the researchers wanted to look at the impact of framing on the choice between different medical treatments. So respondents were asked to choose between surgery and radiotherapy treatment for lung cancer. Now, some of these respondents were patients, some were medics, some were students. One group were told there is a 90% chance of survival following surgery, and a second group were told there is a 10% chance of mortality following surgery. Now, you might notice that is the same probability, but they're framed just differently in terms of survival or mortality. And these were the results. The survival frame led to a substantially higher preference for surgery. And what's really surprising here is that this framing effect was no less pronounced for the medics. So the people with a solid understanding of the treatments and the probability, even for them, regardless of knowledge and expertise, how they were primed to think changed their understanding, and it changed how they responded to the question. So this is just one example of how our words matter and our frames matter. The ideas that we can trigger through that matters, because this really shapes how our issues are seen and understood. Another example from some of our own research in a different issue area, just to illustrate how framing can change support for policies and programmes. This graph comes from the original research that we did with Impact on Urban Health, and it shows the results of a large-scale experimental survey in which we were testing different ways that we could frame the issue of childhood obesity. Now, we had a control group, as we always do, who were asked a series of questions about their support for policy change to tackle obesity and their belief that society must act. They're represented by that thick black line along the zero horizontal axis. Another group were read a statement using childhood obesity as the central frame. Then they're asked the same questions. And another group still read a statement using improving children's health as the central frame, and they were asked the same set of questions. And as you can see in these results, the support for policy change was significantly strengthened when people were primed with this idea of improving children's health. So, and as you can also see, childhood obesity, which is the frame that was already generally being used by the field, was giving us no statistically significant results. We might as well have said nothing, as we did with the control group. So this just shows us that when we get it right, when we find the right way to frame our issue, we can significantly boost support for policy change and a belief that we can act on an issue. It's also important to understand that everything is already framed. It's just a question of whether we do so intentionally or not. Now, I'm sure we've all had an experience at some point where we've said something, but the person that we're talking to seems to hear something completely different. And you can find yourself wondering how you've been so completely misunderstood. Now, this happens all the time with our professional communications too. And this is because people aren't blank slates. We all have our own beliefs, experiences, and ways of making sense of the world. And because the world is a constant source of information, we develop very quick mental shortcuts that help us understand it. And we call these mindsets. When we don't understand the existing mindsets that are at play, we can often find ourselves lost in translation. And if we don't consider how we frame our communications, we essentially aren't giving ourselves the best chance of being really heard and understood in the way that we intended. So that's why our research starts by seeking to understand what mindsets people hold on a given issue. We want to know not just what people think, because attitudes like that can come and go, but we want to know how they think. How are we reasoning about this issue? So mindsets are the deep patterns of thinking that shape how we understand the world. They are implicit and they are shared across culture. They're also enduring. And they are activated by the things that we see and hear. So whether that's the papers we read, TV we watch, the conversations we have, all of those narratives around us are constantly triggering certain mindsets so we can think fast. In short, we don't just see things as they are, we see things as we are. And framing works when we're able to navigate these mindsets, strengthening ones that are going to be more helpful in achieving positive social change and avoiding the ones that are just going to get in the way of the conversation that we want to have. So when it comes to homes in the UK, this is what our research surfaced, certain ways of thinking that we identified as obstacles which we need to overcome. So I'll talk you through these. First of all, a very dominant way of thinking we saw is people in the UK tend to think of housing as being first and foremost a source of investment and wealth. So this is triggered by things like talk about the housing markets, that idea of getting on the property ladder. Now, this becomes an obstacle because when we have such a focus on owning homes, rented and social housing can be seen as more temporary. And therefore, people don't see the importance of it so much. People don't also grasp necessarily what social homes are because they are just not talked about as much as we talk about owning a home. People are less clear about the positive impact that having a decent home has on our lives, while people can more readily reason how a poor quality home might negatively impact us. The idea of a decent home, people tend to understand that as being a sort of neutral state rather than seeing the real value that that can bring. We did see that people could see that there were inequalities in our housing system, but when probed on that a bit more, people tended to just sort of feel that that was natural rather than seeing how those might have come about or how those could be addressed. There was a sense that it's not great, but it's just the way it is. When we probed people around, what do you think we can do if somebody wants to live in a better place? People tended to default to this idea of individualism, that we are all responsible purely via our own choices and work ethic. And so people tended to reason, look, you just need to work harder to afford a better quality home. And lastly, but not least, a mindset that we see on a lot of social issues, this sense of fatalism, that there is a problem here, but the problem is just too big to solve. And so where do we start? The good news is we also found much more productive ways of thinking, which we can bolster with the right framing, which we can bring to the fore, rather than triggering these less helpful mindsets, which tend to be more front of mind. And there are ways that we can fill in gaps in people's understanding too. Now, this might be a good point for me to reiterate that this work is about shifting how people think about homes in the UK. And we've tested these strategies to see how different framing can shift people's understanding and their support for policy changes, in this case, building more social homes and so on. So our research isn't about asking people, do you like this idea or message? It's deeper than that. It's understanding how we can move people, how we can build understanding, how can we find the right frames that allow us to have the conversation which is going to lead to progress. Often messaging on an issue can look a bit like what's on screen. So lots of different people and organisations sharing different things in different ways. And if you are listening from the outside, it can be very hard to hear a clear signal or gain a clear understanding through all of that noise. But when we draw on the same frames, the same communications principles, our communications across a field can start to look a bit more like this. So I would encourage you to think of frames almost like a scaffolding, which a whole sector can use to structure their communications. You can still be tailoring your communications to your audiences, dialing different elements up or down, but always by fundamentally using the same underpinning ideas, we're just going to have a better chance of cutting through. And this isn't about everyone saying the same thing in the same way, but it is about using framing to support the same overarching story, because that's how we're going to shift understanding and build support for building more social homes. So how do we do that? How do we build our story about social homes? When we're telling any story, we need to answer these questions. These are all questions which we unconsciously ask ourselves when we encounter information. And when these questions are left unanswered, we'll tend to default to those dominant mindsets that we hold on a given issue, those mental shortcuts that are much more front of mind. Now, as communicators, we need to make sure that we're not leaving gaps which might be filled in with some of those unhelpful ways of thinking that we found in our research. So I'm going to use these questions to show you how you can build a story and weave in helpful framing which has emerged from our various pieces of research. Now, we might not all answer all of these questions in our communications all of the time, but we should be thinking about them across our comms as a whole and ideally working as a sector to try to answer them all. So think about those arrows, how you could be playing your part to build a certain, add in the gaps that are missing in this story. So we're going to look today at what's this about? Why does this matter? How do we answer, how does this work? And if it's not working, why not? And lastly, what can we do about it? And apply this to how do we make that case for building more social homes? So our first question, what are social homes and why do they matter? How can we draw on our framing insights to effectively answer this question and build the understanding that we need people to have? So first of all, connect social homes with our health and well-being. And this is something that we have been, quite frankly, banging on about a lot in our webinars so far, but it still absolutely is something we need to be keeping front and fore in our communications about social homes. Because in both our wider work looking at homes and in our more specific research into framing social homes, we found that making this connection with our health and our well-being was so important. When we connect having somewhere decent and affordable to call home to our mental and our physical health, we help people to see why it really matters. And this is helping to counter that sense that homes are important because they make us money, with actually no, homes are important because they are the fundamental thing which improves our health, our well-being and our lives. So how do we do this? Make the connection between social homes and health and well-being early and often, as it has that potential to redirect people's thinking in a much more helpful direction. Give examples of how social homes positively impact our health and well-being, and also the negative impacts of the shortage of these homes. For example, we can talk about how more affordable social rent lifts the burden of stress. We can also talk about how the quality of social homes is important, as cold, damp homes will otherwise have a negative impact on our health. An example of how that could look, we could say, social homes offer more secure tenancies than private renting. And this allows families to put down roots and plan for the future instead of living with the constant stress of uncertainty. See how in this example we are getting to the why the secure tenancy of a social home matters in relation to our mental health. And I'd say as well, this connection with both mental and physical health is we saw it to be helpful in our work, but particularly this connection with mental health. We saw that this was really readily accessible for people in understanding why it's so important that everybody has a decent place to call home. And in the case of social homes, that really makes that case for enabling everybody to be able to afford a decent place to call home. Another thing that we need to do to answer that overarching questions is answering the what. What are social homes? So we need to build understanding of what social homes actually are. Now, for anybody working in this space, this might feel like a very obvious question, But we do need to spell out what we are talking about. Many people are unclear on what social homes actually are, so we need to be clear about what we're calling for. Some people won't be familiar with the term social homes or social housing, and even if they are more familiar with perhaps council housing, they might not know what this really entails and what it is. So we can't take this understanding for granted, and we need to define what social homes are, simply and succinctly where we can and as much as possible. So for example, we could say social homes are provided by local councils or housing associations. You might explain what those are. You could say not-for-profit organisations that own, let and manage rented housing. They are designed to be more affordable than private renting and provide a more secure long-term foundation for people's lives. So this is just an example. There are other aspects you might want to focus on that help to explain what a social home is. But the key thing is to just not assume that everyone will know what you're talking about. So whatever understanding you feel that people need to have in order to land your point, make sure you're spelling it out and doing that in simple terms, jargon-free. Now, for each of these questions that we're answering today, I also have a watch out, so something to be cautious of and think twice about in your communications. And our first is this: to be cautious and avoid leading with economic arguments. Let me explain why. So in our research, when we were looking specifically at building support for more social homes, we were looking at different ways that we could connect this issue with other things that people will hold as important. So what we're talking about here is, if I'm to get technical for a second, different issue frames. These establish what a topic is actually about. So for example, you could say that social homes are at their core about reducing poverty. You could alternatively say that social homes should be considered first and foremost about supporting our economy or about improving our country's health. And there are, of course, many dimensions to this issue, but we wanted to find which issue is the most helpful one to lead with, to really open up how people think about social homes. And when we tested health, poverty, and the economy, we found that the poverty and the health issue frames were effective, increasing people's understanding for policies and their support for policies to build more social homes. So the asterisks here are just indicating that these were the statistically significant changes that we saw. Whereas that yellow bar, the economic argument, it didn't make a statistically significant difference. It wasn't doing harm, but it also wasn't helping us. So what does this mean for our story? Talking about social homes in terms of economic benefits alone doesn't really boost support at scale for building more of them. It doesn't make the case for why they matter. If you want to include an economic argument for social homes, I would encourage you to do this after first establishing those benefits to people's health and well-being. Or consider making this part of a wider point about how social homes prevent poverty, which I'll get into in just a moment. But don't just rely on that economic argument alone, because it might not be doing as much work as you think it is. That's what our research would suggest. So answering our second question, how do social homes work? And if they're not working, why is that? So this is really filling in that that middle part of our story, almost building that understanding, filling in gaps. As we touched upon in that graph, explaining how social homes prevent poverty can be a helpful way of building support for having more of them. But we do need to explain how this works rather than just stating it. When people understand the point that we're making, they are far more likely to agree with it. That might seem like a very simple truth, but it's one that we need to keep in mind when we are building our communications. Because when we explain, it's like we're showing our workings. It's helping to lead people to the same conclusion as us, rather than just expecting them to take our word for it. If we make a statement like this, social homes prevent poverty and hardship, without explaining how social homes prevent poverty and hardship, we're taking a big risk, because we know that people are likely to fill in the gaps with the most dominant mindsets. And in this case, that's likely to be something like this: so does working harder. So it's not making the case for building more social homes. We're not filling in that gap and bringing people along with us. But when we explain step by step, we can fill in those gaps in people's understanding. We can walk people through how social homes prevent poverty and hardship. So we can say social homes can prevent people from becoming trapped in poverty because they are the only type of housing where rents are linked to local incomes. So this helps to keep rent affordable and stops people's incomes from being squeezed. The solution, therefore, is to build more social homes, which would relieve this pressure for many more people. So in this example, I've been really explicit about those links between cause and effect. And this might sound obvious, but using words like because, this means, this leads to, this helps to weave together your explanation and point to those connections. But we do, above all, need to make those connections, walk people through, show people how this works. Another helpful device we can use for explaining how social homes prevent poverty is this metaphor of restricts and restrains. So this is a metaphor that emerged from our reframing poverty research, and it helps to show how people can get locked in poverty, how it restricts their options and opportunities. And it can also be used to talk about the solutions. So in this case, social homes. For example, we can say, social homes help to release people from the constraints of poverty. Social homes unlock opportunities for people. Social homes can loosen poverty's grip. You could use this metaphor as part of a fuller explanation, like on the previous slide, but even by itself, it will prompt a better understanding of the impact of poverty and the idea of it as a force or a pressure which can be lessened by social homes. And this is an example of something which is building on a more helpful but less dominant understanding that we saw people held when we did our talking about poverty research. So an example of how that could look, we might say that having the solid foundation of a social home is essential for people who are struggling under the weight of poverty. An affordable place to call home relieves the pressure on people's lives and on their mental health. And see how we've also woven in a bit of health here, because as I said, this is such a helpful way of us making that connection of why a home is so important. Now, the other part of this question, the sort of explaining how this works, is perhaps explaining how it doesn't work. So we need to show how supply and quality of social homes have been undermined. Thinking back to those obstacles we need to overcome, we found in our research that people could see that there are problems in our housing system. They could see there are inequalities in the system, but they put this down to that's just how things are. So again, we need to fill in this gap of understanding and explain how supply and quality have been undermined and who is responsible so that we can make a case for changing that and not just accepting that this is our lot in life. So how do we do that? Break it down. There are, of course, lots of reasons why we don't have enough social homes, but we need to focus on one aspect of the problem at a time. You don't have to cover all of the reasons in one piece of communications. And remember that many people are starting from zero. So start by naming who's responsible. This can help people to see that this is not a natural problem, but one which has been created and therefore can be changed. Explain how problems have come about. So remember that sort of showing your workings, leading people through step by step, and point to what can be done. And we'll cover this more in the third section today, but solutions are so important, such a massive part of the story here that I'm getting in an early mention as well. But what could that look like? This using these tips to build that explanation of how supply has been undermined. It could look like this. Since the 80s, successive governments have largely relied on private developers to take responsibility for building social homes. But social housing providers of all kinds have lacked access to the resources and powers needed to come close to meeting our need. Whoever runs our next government, we need them to step up and start taking responsibility again. So here, naming successive governments, that's us naming, who got us here, explaining an aspect of how we got to where we are, and then pointing to a solution. Those sort of 3 points there are building that story. I've also used this term, we need them to step up, because this is a helpful way of us, again, indicating this responsibility and need for action, how those with resources and powers could make sure that others are able to step up. Our watch out for this section is to be mindful of data. So using data to support our story, but not relying on it to tell it for us. So to build support for more social homes, we need to go further than the numbers, but well-framed data can be part of our story. My top tips here for using data effectively is first of all to put it in context. So this can include a narrative to explain your numbers rather than leaving them to speak for themselves, but also considering what reference points people might need in order to see what they really mean. For example, if we are talking about how many social homes we need to build, could you add context like how many were built last year so that people have that sort of a relevant number to relate that to? Speaking of relating, make numbers relatable. So especially very large numbers, which are very hard for us to grasp. For example, if we talk about 3 million households, but people have no idea how many households there are in the UK, then we need to do something to make that number relatable. You could instead say perhaps 1 in 10 households, check that number though, or compare to the population size of a particular city so that people have that sense of scale rather than it just being this kind of big unknowable number. Thirdly, don't just throw all your numbers at your communications. Select and reject numbers strategically to best serve your point. It is always better to have 1 or 2 numbers which are really clear and which really support your story rather than giving people all of the data to wade through. Now, I would say the exception to that is there will be cases where you're doing a big report and you have lots of data and you want to share it. In those cases, really think about how you can use your XX summary to best effect. Really pull out what's the thing you really want people to take away and frame that really well. Lastly, a good way of sort of checking your workings is to always ask yourself, if you took the numbers out, would your point still stand? Is your story still there? And if it's not, look again and consider how you can provide narrative and context around the data. So we've looked at how we need to define the issue of social homes, how we can show that they matter, and how we can explain what is and isn't working. Now, our third question to complete our story is all about showing that we have the solutions and building belief that they are possible to answer what can we do about the shortage of social homes. Now, across all manner of social issues, we are up against a big unhelpful mindset of fatalism. Fatalism is that sense, again, that a problem is too big or complex to solve, so there's not much point in trying. And the best tonic for fatalism is to talk about how we can change things for the better and to show how. So my answer to this question, how we can draw on framing to answer it well, is to get specific about solutions in the short and the long term. Talk about what we need to do now and tomorrow and the next day and the next day. We need people to see the solutions as both urgent and possible. So how do we do this? How do we build this sense that it is possible? First of all, talk explicitly about the fact that we can change this. So in our communications, it can be tempting to think that we just need to show people how big a problem is, that that's the thing that's going to make them care and make them get on board with us. But people do already grasp that our housing system isn't working as it should. What's missing is the understanding of how we've got here, as we've just covered, and then knowing what can be done and understanding how that all adds up. So as well as explaining the problem, explicitly talk about how we can solve it. Do this by giving people concrete solutions and mention them often and early. So although I'm covering this point last today, that doesn't mean that solutions should come at the end of your communications necessarily. Again, it can be tempting to do this, to feel that we have to explain a problem in detail first, but we can actually start with solutions first and then explain why they're needed. We can pepper solutions throughout our communications. Whatever you do, don't bury them and don't feel that you have to hold them back as a big payoff at the end, because some people simply might not read that far. And what we read early, what we read first, influences how we then take on the rest of the information that we're reading. So if you're bringing in a solution early, then early on in your communications, you are giving this counter to the fatalism that we know we are up against. Thirdly, when we're talking about social homes, this is of course something that will take time to fix. It takes time to build as many social homes as we need. But one way that we can make the solution feel more in reach is to, again, break it down, just as we talked about breaking down the problems we're up against. So yes, we have this big goal to aim for, and that's important. But consider how you could also talk about smaller steps. What can be done right now? What needs to be put in place in order to allow that long-term goal to happen? And our third watch out is to not overdo crisis messages. So while naming the housing crisis can build salience and show urgency, if we go too hard with messages about crisis and focus too much on the problem without offering solutions, we are likely to trigger this sense of fatalism, and we just don't want to do that if we can avoid it. So we can address this by balancing this out in both tone and content. Again, making sure that our solutions aren't buried at the end of communications. And yeah, just looking back and thinking, how is that making somebody feel? Have I made people feel like something can be done about this? Have I just reiterated a problem which actually they already knew existed? So an example of how we bring this together could look like this. We urgently need our government to step up and invest in our health by building more social homes. From the Second World War up to 1980, we were building an average of around 126,000 social homes every year. Last year, there were only 7,528 new social homes. We've done it before and we can do it again, but we need our government to act now and put in place a long-term plan for increasing the number of social homes. So note the tone here. It's urgent, but it's focused on solutions. It's not leaving people at the crisis point. It's saying that we can and we must change things. So talking about what needs to be done and created, and not just a crisis and what needs to be avoided and ended, is a good way of thinking about this and getting that balance right. So just to summarise what we've covered before we wrap up and head into the Q&A, I'm really keen to answer your questions. This is what we've looked at today, these three points of our story and how we can answer them. So we need to answer, what's this about and why does this matter? And the things we can draw on for doing that are connecting social homes with our health and well-being and building the understanding of what social homes are. That middle point, that explanation point, telling people, how does this work? And if it's not working, why not? This is where we can really draw on how, explaining how social homes prevent poverty and hardship, and also showing how supply and quality have been undermined. And thirdly, last but not least, what can we do about it? And this is where we need to get specific about our solutions in the short and long term, and watch our tone as well. Now, we've created a short guide that summarises all of these key points and has examples as well. I'm sure it's been popped in the chat by now, and if not, well, we'll be sending it a follow-up email as well, because it's a great resource and something you can look back at. So do take a look at that. I think it'll be really helpful for jogging your memory of what we've covered today, and hope it's really helpful for you in your work. Remember that this isn't about us always needing to answer every question, but it is about thinking how, as a sector and as a movement, we can answer all of these questions together, and how we can use the same underpinning framing principles to help us do that, because that's how we're going to fill in the gaps in people's understanding, and that's how we're going to shift the conversation and be able to really have the conversation we need to be having to make change happen. In just a moment, I'm going to stop sharing my slides and go to Kate for some questions in our Q&A. Before I do, just a quick plug, if you'd like to keep in touch with what we're doing at Frameworks UK, do visit our website, frameworksuk.org. There is also a Frameworks Institute website, but go to the UK one. That's going to be much more relevant for you. That's us, that's the UK-based Frameworks UK. Do also follow us on LinkedIn, and you can stay up to date with us also by signing up for our emails, which you can either, if you're very quick with your QR code, you can grab that one that's on screen, or you can just, again, find that on our website. Just say you'd like to hear from us via email. Right, I'm just going to bring my slides down and give Kate a moment to gather a few questions so we can hear from what you've been popping in the Q&A.
Hi, Sophie. Thank you for that. We've had lots and lots of questions come in already, so thank you to those who've put those online. from now on, it gets harder to look at them and ask them, but they've grouped together quite nicely. And there's really two clusters of questions really that I think we should start with. The first one is about the economic case, and the second one is about the audience. So can you say something, Sophie, about who the audience for this approach to framing the issue is, and who we tested the work on, and if it's necessary to use different frames for policymakers in particular?
This is a question we get asked a lot, and it's a good question. But the way that let me start again. The way that we do our research at Frameworks, the reason, as I said at the beginning, that we do these big, large-scale, nationally representative surveys is that we are looking for communications principles which are going to move the most people in the direction that we want to move them in. So in short, that means that what I'm sharing today is a story which should work for building that understanding across our society. Within that, we can always check to make sure that what we're recommending isn't backfiring for particular groups. But this is what we're aiming to do with this work. It's about shifting everybody. What I would say is that if you know you are communicating to a particular audience, and if you have further insights about a particular audience, you can always layer that on top of a framing strategy like what I've shared today. What I would always suggest is that you're just conscious of not going with something which is then maybe going to inadvertently backfire for others. So you can almost think of this, I keep doing this because I think of our framing principles as almost being that kind of overarching guide, and then you can layer on top of that other things that you know about your audiences. One note of caution I would say though, is just to remember that policymakers are people too. They are part of the same culture that we've looked at. They hold the same mindsets that we all hold. So even if a policymaker is saying, show me the money, show me the figures, it is extremely likely that they are still holding these less helpful mindsets and need to still be shifted in this same direction that we're looking at for the wider public, which is why I say that even if you're making, for example, an economic case for a policymaking audience, don't leave out the other things that we found to be helpful. Don't leave out that reason for action, which is first and foremost, this is to improve health of our society. So you can do both. And a lot of this is about sequencing. So setting up first that reason for why, and then getting into your economic argument, for example.
I think, Sophie, one of the things you said during the presentation was really captured it, which was sometimes you might need to use economic arguments if you're speaking to somebody from the Treasury, for example. That's the terms on which they operate, but never rely on the numbers to do all the work for you. Never rely on the economic case alone, because frankly, it hasn't worked so far, and our research explains why.
Absolutely.
The limitations. Sophie, there was an observation made by one of our participants that you were using homes rather than housing, and she was pretty spot on in figuring out why that would be. The framing of social housing makes you think of building as an asset, whereas social homes evokes thoughts of individual well-being. Do you want to say something a little more about that?
Yes, absolutely. And this is something which I've drawn out a bit more in previous sessions and was hoping to weave it in today, so I'm glad that somebody has asked. So we found that when we use this sort of language of homes, we are invoking that more holistic sense of what our homes are for. So it helps to connect people with those things that are important to them and are central to their lives, rather than thinking about a house, bricks and mortar, and as you say, more likely to think of housing as that sort of asset. I would say there's worse terms as well. So I would definitely sort of try and steer away from terms like, housing stock, units. All of that is getting even further away from that sense of homes and why this really matters, that sort of sense that this is a foundation for our lives. So, while today we've been looking at these sort of using framing to bring forward these ideas and not getting so tied up in specific language, it is the case there are some words which are very helpful for triggering those helpful ideas, and homes versus housing is one of them, and that's why I've been saying homes an awful lot today.
Yeah, as you say, so Sophie, framing is about ideas more than it is specific words. Nonetheless, we do have some more word questions. Because I guess words help people us to embody different versions of the ideas that we're trying to evoke. So it makes sense that people would want to ask about that. Do you have any thoughts on the term affordable homes, if that's any better or different from social? Some people were querying whether social came with stigma and baggage.
So I would say that we didn't particularly see social homes coming with a sort of stigma or baggage in our research. I think whether we're talking about affordable homes or social homes, the really important thing here is to explain what we mean, because just that term alone isn't necessarily going to be doing all the heavy lifting that we might think it does, or those working in the sector who have that deeper understanding of the issue will be bringing to this. So affordable homes, social homes, I think I have no issue with either, but what I would have an issue with is assuming that people will definitely know what we mean unless we give a little bit of background. So that sort of actually saying what are they, regardless of what term you're using, is probably the more important thing to be keeping in mind.
We had an interesting observation from one of the participants, Sophie, who works in this field, advocating for change and making the case that more investment needs to be made in social homes for the sake of people's health, in particular disabled people and children. And she's pretty frustrated at the lack of progress that she's been able to make. So she's asking what might make a difference. She's already making that connection, it would seem, between homes and health. I wonder if she's up against a bit of fatalism, a bit of naturalism, the sense this is the way things are and must be, and more of a solutions focus might help.
Yes, I think this comes down to, I mean, first of all, it sounds like you're doing great work, so well done and do keep going. I think it's, yes, absolutely telling that complete story so that as well as saying, why this is so important, actually pointing to what good looks like and how that can be achieved. I think this also just hammers home that point of why we need to get everybody doing this, because actually if it's not just, I'm not saying it is just you, but when you have more and more voices, that sort of chorus who are all saying, look, this is the reason for action, it becomes increasingly harder for that to be dismissed. But yes, in the meantime, as well as more people hopefully joining in, just building that complete story. I think as well, there's other things we've not drawn on today that we can absolutely have as tools in our arsenal to sort of bring to life that point more of really making that connection between our homes and health. So, for example, drawing on real life stories, but connecting that to the bigger picture, I think is an extremely effective way that we can make that connection for people and really make this is a human story, and the more we can humanize it and remind people of the true importance of homes, the better.
You've touched on it there, Sophie, but Jackie Peacock asks how useful do you think enlivening stories with lived experience is in this work?
I think it's absolutely something which brings this whole thing to life, and it takes it beyond us just talking about policy and reminding those policymakers that this is people's lives that we're talking about. A few things I would just bear in mind whenever we're telling stories from lived experience, whether they're our own or supporting others to tell theirs, is just to always bring it back to that bigger picture, because we know that when it comes to issues like homes, there can be a tendency for people to write things off as being kind of exceptional or sort of down to individual actions, just because we have that understanding of individualism being so sort of front of mind, that mindset, which can hinder that more expansive thinking. So just wherever possible, where we can be baking in context to our stories, so adding in scale, adding in that sense of context, asking people the sort of questions that will elicit that kind of connection to this isn't just what happened to me, this is actually I'm one of many, is very helpful, and something which we need to do to make sure we're not getting those sort of people writing off a story as exceptional and instead seeing it as a representation of the issue.
I think that relates to a question from Kyla Ellis and others about how people who are living in social homes are represented and often talked about. And essentially, it's how we talk about poverty and how we frame poverty. And perhaps that's a whole other body of research that we've done, right, Sophie, in terms of how to talk about poverty in ways don't stigmatize people or blame individuals. But is there a couple of highlights of that you'd pick out and recommend to people?
Yes. So I guess first of all, we're still thinking about people's stories. It's that kind of the danger of a single story, and the more ways that we can tell those sort of shared stories and experiences, but show how that shows up in people's lives in different ways, I think can help to sidestep that tendency to stereotype. And actually, it makes it much harder to kind of write this off as being down to certain tropes or stereotypes, when actually we are bringing this to life through varied experiences, various ways that this shows up for good and for bad. And I think as well, this is where I would say telling those positive stories about positive impacts are very important, as well as negative impact, because actually it shows what a social home gives you, that foundation, what it allows you to do. And the counter to that is how when we don't have that foundation, and when we are otherwise, weighed down by poverty, we're so restricted and constrained, and you can't just try your way out of that when you are so sort of trapped in poverty. So those are a few things I would draw from for countering that kind of stereotypical way of thinking.
Thank you. So a number of questions about how this research also relates to particular groups. Obviously, people who are trapped in poverty, but also people from migrant communities. Did we consider any differences in how we need to frame the issue when it comes to people from migrant communities?
Now, this is something where, like, as I said at the beginning, all of our work is based on evidence. And unfortunately, we don't have the evidence yet for how we can best frame this when we're talking about people who've immigrants, communities and housing. So, I mean, first of all, anybody who would like to look into that, please get in touch. We would love to be able to look at a really solid evidence base, and especially as we see that this is increasingly becoming part of the conversation. We are also, you might be aware, some of you out there, that we are running a new Moving Mindsets program in the UK, where we are looking in a bit more detail at some of the core mindsets that people hold on health and poverty and related issues such as homes. And we've just got some of the very first findings of that back, sort of looking at some connections between different mindsets on these issues. And we did find that people who were more likely to oppose social homes were also more likely to hold anti-immigrant beliefs. So there is a correlation here that we need to understand better. We need to know how to talk about this, but the only way that we can really do that with certainty is to do the research.
Thanks, Sophie. Fatalism and individualism have come up in this research, in terms of people thinking individualistically about homes as an asset, and thinking fatalistically about the state of housing and homes in the UK. How does the UK compare to other countries, and have we seen big differences? If they were particularly bad? I'm not sure that we've really done the work elsewhere to be able to say that.
Yeah, I don't think we really know. I couldn't, it's not quite as top of mind for me what our colleagues in the States are doing, for example, but I mean, I do know that top of mind individualism and fatalism are also playing a part there.
I think it's worse.
Yeah, yes, it might be a bit worse. I guess one thing I would say though is whether we're better or worse in another country at this is kind of by the by. It's how can we just do a better job of countering that here? We are talking about our housing system and how the changes we want to see in our society. So we do need to look to ourselves for the answers, and that's why we've done this research in the UK context. It's interesting to know how we compare to other countries, but I guess in terms of how it serves us to actually do the work, it's perhaps not so relevant.
Yeah. Sophie, we talked before about who this work is aimed at, and discussed how this is about reaching as broad an audience as possible. Do we know anything further about how these frames, these recommendations that you've made, play out with different people with different political leanings? I asked that partly because there was a question of, is this really about understanding, or is it really about political ideology?
So interestingly, another of our sort of early findings we've had from our moving mindsets work, where this is one of the things we've been looking at, is, I mean, it's good news, which is that actually there is very high support for social homes. And while that is highest amongst Labour voters, it's actually still a high level of support across Labour, Conservative and Lib Dems. So I think actually this is an issue where even more so that we need to be making that point to everybody, because it's not as if there's just sort of one type of voter that is holding us back from this. It's that we just need to be pushing this onto the political agenda across the board. And that, you know, the good news is we're talking to a pretty high level of support and interest already. So it's just about building on that. This is not an obscure issue. This is an issue that people are wanting to see action on. And so I think we need to capitalise on that, and particularly in a general election year or so. Who knows when exactly that will happen. But yeah, now's the time to be making those points.
Question in about sustainability. So did we look at the idea of social homes being more sustainable homes and test that in the research?
We didn't look at that specifically. We when it comes to doing our research, we do have to stop somewhere with how many things we can test at any given time. But I would say that some of the changes that we would make to make homes more sustainable would also just make them better for our health. So for example, a better insulated home is more affordable to heat, or stops it from becoming too hot in summer when we're living in an increasingly warming climate. So while I do not have the evidence to necessarily make that sustainability point, I do think we are not at cross purposes. And so there are perhaps still some things from our research that you could draw on to make that case for both. And given how we've seen how much of an opening is to make that connection with health, I think it's fair to say that perhaps connecting that these changes that would make our homes more sustainable would also improve health is a good opening to be going for.
I think we're nearly out of time, Sophie, but just to finish by noting a comment from Sue in the chat saying, are there any examples of where this has been used and it's worked? And I guess we would respond to Sue by saying, this is pretty new, right? So now's the time to do that.
Yes, absolutely. What I would love to see is in the course of the next year, us be able to point to something and say, this is starting to work. So yes, that's an invitation to get involved.
There are more questions, Sophie, but I think we're out of time. So back to you.
Great. So yeah, thank you everybody so much for joining. Thanks for putting your questions to us. Hopefully we've answered a good number of them. We'll be following up, as I said, with the resource that summarises everything we've covered today and a recording. And do get in touch if you'd like to work with us more closely on this. But for now, thanks very much.